Hello everyone. In this lecture, we are going to study about homeopathic remedy and their indications in hemorrhage. In the previous video, we learnt about arnica and hemimillis and its indication in hemorrhage. Here, we'll learn about calcarea carb and camphora. First, I'll be dealing with calcarea carb and then camphora. Calcarea carb, ailments, loss of vital fluids, self-abuse, overlifting, mental strains, suppressed menses. May it be physical or mental strain, that will be the ailment, that is overlifting and mental strain, loss of vital fluids, self-abuse, suppressed menses. Sphere of action, blood, bones, skin, glands, female genital organs. Nose, swelling at the root of the nose, epistaxis. Urine, dark brown, fetid, abundant, bloody. Calcarea carb is a remedy par excellence for menstrual troubles. It is suited to ladies whose first menstruation, that is menarche, commenced at an early age. The time, too early, too profuse. Quantity will be too profuse. The duration will be too long lasting. Which means, how will the menses come? They come early. The quantity will be profuse. They last for a long time. The color of the blood will be bright red. Modality, least mental excitement causes profuse return of menstrual flow. A little mental exertion by them, it will cause a return of the menses. Again there will be menstrual flow if they do a mental exertion. Before menses, headache, colic, chillness and leukorrhea. Cutting pains in uterus during menstruation. After menses, pinching type of colic. Here they are mentioning about the concomitants of the menses. Before the menses come, there will be 4 things, that is headache, colic, chillness and leukorrhea. During the menses, there will be cutting pain in the uterus, and after the menses, pinching type of colic. These things you need to remember. Respiratory, bloody expectoration with the sore sensation in the chest. Anemic symptoms following hemorrhages in soric leukophlegmatic patients who feel worse when the limbs hang down, even in bed, wishing to keep them drawn up and feel better in a dark room. Here they are mentioning about the constitution of the calcarea carb. How is the patient? He is anemic and they are leukophlegmatic patients, which means the patients are prone to catch cold easily. They feel worse, and so basically when they keep their legs hanging down on the bed, they feel worse from it. They always feel like keeping their legs up on the bed, and then they feel better in a dark room. Hematuria, that is blood in urine, polypi and varices of bladder, hemorrhoids of bladder, chronic strangury from standing on a cold pavement. When they stand on a cold pavement, pavement is like the sideway of the thing. Passage of blood and mucus. Thermals, they are chilly patient. Modalities, aggravation from cold air, wet weather, cold water. Amelioration is lying on a painful side. Hope calcarea carb is clear. You have to remember the nose, epistaxis, urine will be dark brown, fetid, bloody, menstrual troubles, early, profuse, long lasting, and then the concomitants, respiratory, sore sensation, bloody expectoration, leukophlegmatic patients, and then hemorrhoids of bladder, varices and polypi of bladder. When they stand on the cold pavement, there is chronic strangury. Passage of blood and mucus, chilly patient, cold water, wet weather, cold, anything that is cold leads to aggravation. May it be water, air, wet weather, and then amelioration lying on a painful side. Next we will be dealing about camphora. Camphora, urine, red bloody, comes drop like canth, which means in cantharis the urine passes drop by drop. Same way here in camphora, it comes drop by drop and it is red and bloody, which means it is highly concentrated. Nose, It is persistent epistaxis, especially with a goose flesh state of skin, which means there is a flesh present inside the nose, goose flesh like state, and then there will be persistent epistaxis. Urine strangury with tenesmus of neck of bladder. In urine, two things you need to remember. The urine is scanty, red, bloody, and it is drop by drop passage. And it is, along with that, there will be tenesmus of neck of bladder and strangury. Scantiness of discharges, that is urine, vomiting, diarrhea, is a characteristic of camphora. May it be any discharge, it will be scanty in camphora. Hemorrhagic diathesis. Diathesis is what? A condition or an attribute of a person making it prone to a disease. It makes it susceptible to a disease. Here, hemorrhagic diathesis, which means these people are prone to bleeding easily. Excessive bleeding from capillaries without other prominent symptoms. There will be bleeding from capillaries. Next, we move on to head. In camphora, there will be violent congestion, constriction, and throbbing in pain, especially occiput. Throbbing in brain. So, the brain, congestion, constriction, and throbbing. And where is it present? In the occiput. Sphere of action, digestive tract, urinary organ. Thermal, very chilly patient. Surface is cold to touch, chilliness, yet cannot bear to be covered, throws off all the coverings. So basically, when you touch the patient, it will be very cold. The people will be very cold to touch, and chilliness will be there in that patient. Yet the patient doesn't want to cover. He just throws off his coverings. Ailments, bad effects of shock from injury, sunstroke, cold air, suppressed eruption, vexation. Both extreme heat, that is sunstroke, and cold air, both leads to diseases in camphora. Bad effects of shock from injury, suppressed eruptions, and vexation. These are the ailments. The modalities of camphora are aggravation from cold air at night by motion, amelioration when thinking of the complaint, and warm air. So with this, we come to an end of calcarea carp and camphora. Thank you.